did Austin Radiological Association respond initially to the COVID-19 crisis?
ARA did an amazing job responding really quickly and early on. They formed a COVID-19 task force.
Mm-hmm.
The task force included ARA senior leadership, some of our ARA radiologist leadership, our quality and safety management department, program management, business development and marketing, and our facilities and purchasing department all participated in it. The task force met regularly and continues to meet regularly, and then they communicate directly via email to our ARA team as a whole. So all the employees are getting the same communication quickly and consistently.
How many staff do you have, Stacy?
So overall, we have over 700 employees.
Mm-hmm.
Normally, right now we've had a reduction, but communicating effectively to everybody at one time is really important.
Yeah, I'm sure they really appreciated it. Yeah.
And then we also use that group to communicate directly with our referring physician population,
Okay.
and then also with our community as well. We've been using email, fax, our website, and also our social media.
Oh, great. Did the governor of Texas stop kind of all unnecessary or non-essential medical, surgeries, et cetera?
They did.
Yeah.
Recently, they are working on lifting that ban, and the beginning of May, they're going to allow elective procedures and elective exams again. So that's really exciting.
Yeah. So you said that ARA kept one specific facility open for screening. Is that how you've been managing that?
Yeah. So ARA in March, the task force designated to have regional ARA outpatient imaging centers specifically for chest x-rays for medium risk patients during the COVID-19 crisis. We developed 2 respiratory diagnostic imaging centers, one in our central Texas, Austin area, and then one in north of Austin, which is Georgetown, where I am at. In March, we started seeing medium risk patients at these respiratory diagnostic clinics, and all the rest of the ARA clinics would send their medium risk chest x-ray patients to one of these 2 clinics in order to keep those medium risk patients out of our normal flow of patients. And then just a week ago, we actually started seeing high risk patients as well at those clinics.
Oh, did you really? Mm-hmm. So tell me about the process. That's really interesting because in a lot of areas, it's like in Pennsylvania, it's just shut down. I mean,
Right. Yeah.
If you need to go see somebody, I call your doctor and they'll tell you where to go. So tell me about that process. Yeah.
It was really important for ARA to continue to offer services to our community while also being safe. So that was our approach in handling the situation. So some of the things in the center is, one, we ask for team member involvement. I believe our best resource is our team. So we asked our team directly that would be working the RDIC for their feedback about setup, the tools that they would need, workflow suggestions, and then we implemented those. One of the workflow suggestions we implemented was having a paperless process. So we don't have any paper in the RDIC clinics. Instead, we're using the touchscreen laptops and using disposable styluses for patient signatures. We also focus a lot on patient safety. So we provide all those medium and high risk patients with an N95 mask before entering the clinic. All of our employees have been refitted for the right fit for their N95 masks, and we're providing full PPE head to toe for our entire team that work in and around those clinics. That way we can keep our employees and patients safe and make sure that we're keeping the spread from happening. Sure. And then obviously facility cleanliness has been really important. So we clean all our clinic surfaces, the equipment, countertop, everything in between every patient interaction. And we have large stickers that we use that we put on the floor for social distancing.
Oh, that's cool.
We'll have a visual cue of where they need to stand and stay away from other people.
I need one of those stickers for my collection, political collection.
Okay.
I collect a lot of political signs. So after this is all over, I need one of those.
Absolutely.
If you could autograph it, that would be great. So did you have trouble finding PPE? I mean, how are you getting that?
Yeah, so ARA worked really hard in locating and obtaining medical supplies and PPE really early on, finding creative solutions to ensure that we had the tools to keep everybody safe. So for example, we had cloth masks made for all of our staff. So some of our team members' wives sewed them for us. We hired a sewing team to go and sew us 1,000 masks. And that way we could give all of our employees 2 cloth masks to wear in addition to providing, normal PPE. We set up screening stations at all of our employee imaging centers. So first the employees screen themselves, we take our own temperature, we fill in an employee screening form before we're allowed to come to work.
Yeah.
Then we also screen those patients. So we have paramedics and technologists that sit outside of our imaging clinics and screen the patients to ask them questions about fever, respiratory symptoms, COVID exposures. And then we also check the patient's temperature to make sure they're not running fever before allowing them to enter the clinic. Then
it's really, I got to tell you the story. It's really interesting. I had to go to a neurosurgeon. I had bad sciatica this winter. And it was right after the COVID, right after this started. It was in February. Okay. It was before I came to Texas. And I'm checking in, and the woman checked me in, and I said, "Hey, how's it going?" I said, "Do we need to wear masks?" She goes, "Oh, somebody stole all of our masks." They had masks out in the waiting room for flu season. But then she's going through the question. She says, "Have you been exposed to anybody?" And I'm like, "Well, how would I know that?" And she goes, "Well, just say no, because if you say yes, you're not going to be able to come in here." So I'm sure your staff wasn't doing that, and none of us are anymore. I just keep reflecting on the early days of this when we were a little looser, so to speak.
Yes,
Yeah.
it was a little more challenging at the beginning. We worked on creating flow charts for our employees so that they would know how to properly give patients masks. So which patients needed surgical masks, which needed N95, which patients we weren't going to see, and which ones we could, and then how to direct them accordingly. That was really important.
Right. Okay, great. And then, we're all learning things about leadership and management now. How has that been leading through this crisis?
It's been very interesting. It's required a lot of adapting and transition. We're learning every day, but the big thing is the COVID-19 information has been really scary. All the stories have been fear-based. They're all over social media, and they're in our employees.
We're losing our feed there, Stacy.
Can you hear me now?
Yeah, I can hear you now. That's good.
Great.
Okay.
So the COVID-19 information that's out there has all been fear-based, and very little of it is actually factually based, and so much of it is out there on social media. So having it in our employees' hands at all time has been a huge problem. So identifying the fears for our employees, knowing what the source is and where they're coming from, and then finding resolutions to ease those fears and anxieties has been huge.
Great.
When focusing on the team in the front lines during the pandemic, it's important for our leadership to be able to balance the team members' emotional anxieties, their physical needs, their personal well-being, also while redirecting them back to their professional responsibilities. I've often had to remind my team members to stay in the moment, focus on what we can control, which is our response to the situation. We can't control what's happening in these situations, but we can control how we respond to it. So staying present.
Great. Well, you're doing a good job. Your people, we're talking about the doctors and nurses and technologists that are in hospitals, but there's a whole nother world out there, and everybody in healthcare is doing a great job. And when you have to lead it, it's very challenging. So any other advice or takeaways as we begin to reopen, so to speak? What are you looking at there?
Yeah, absolutely. For us, I feel like we need to remember that our actions speak the loudest to our teams. Whether we're front lines or we're supporting teams from home, we need to make sure that we're taking action to show our teams that we hear what they're saying, that we care about what they're saying, and that we're responding proactively. Also communicating proactive with your team and making sure that you're telling them as much as you can early on and upfront, being honest and transparent, and mostly just staying present ourselves is really important.
That's great. Well, I know it's challenging times. I'm sure you've, it's hard to manage physicians, it's hard to manage staff, but being able to balance all that is really good. And I know you're doing a great job down there. So thank you. Thank you. Appreciate you coming on the show.